Hey everyone. So I wanted to talk a little today about, maybe just share for a quick second. Plenty of folks roll through the office who have been told that they need a surgery or they might need a surgery, like say for their back or neck or some kind of joint, arthritis, ankle. And of course, most people aren't interested in hurrying into that, and they're hoping chiropractic care can help them out, maybe help avoid surgeries, and that is the case a lot of the time, or at least significantly postpone the surgery date. And so I want to talk about a study out of Pain Medicine Journal from September 2018 here, the 10th. It asks, are invasive procedures effective for chronic pain? And this is a review of the literature. Now, before I start in on this, I feel like I gotta say, chronic, long-term, intractable pain, is miserable, and anyone who has decided to go with invasive procedures for those things is, I can believe it. This isn't meant to shame folks who have, but maybe encourage and give folks some extra information who haven't gone ahead and done a procedure. Maybe encourage, folks to wait a little longer and see if there's any other options. So, this study is saying that, first, an invasive procedure they define is if any instrument is inserted into the body. And the thing that's interesting about this survey is they include low back pain. A lot of times there's been reviews of studies, and it's been specifically on arthritis of the knee. And if those surgeries actually amount to anything, this survey looks at knee and low back, and they have sham surgeries for both. So very relevant to chiropractic and chiropractic patients. They note opioids have limited effectiveness for chronic pain. This is not new. At least folks have been aware of this for a while. And of course, the problem with those is adverse reactions can lead to death. I didn't know this, but it says here, deaths from opioids now exceeds motor vehicle accidents. So it's a big deal. And so it turns out invasive procedures are increasingly being used for pain, where they just chase after the pain, where there's not such a clear anatomical cause for it. Now, the results here, the conclusions they reach, points of interest are the proportion of improvement due to a sham treatment in low back pain was 73%. 73%. In osteoarthritis, the average improvement in the sham surgery group was greater than after the real surgery. So that's the old placebo effect working better than the surgery. Let that sink in. So on average, pain reduction in the sham groups accounted for 87% of the improvement seen with active treatments. So, point is, wrapping up in conclusion here, there's currently insufficient evidence to support the specific efficacy of invasive procedures for the treatment of chronic pain. Outcomes for 7 studies on low back pain and 3 with knee arthritis showed no difference in pain 6 months later as compared with the sham procedures. So, a lot of times, shortly after the surgery, you are feeling a little better, but 6 months out, which isn't very long, pain isn't significantly different. So, of course, in the end, they make the point that we're left wondering, just how effective surgery is, invasive procedures is for chronic pain. There's really not very good evidence at all. So that does leave us in a bind if we need help with some pain. So let me just encourage you to recommend chiropractic care, see if that's a help, and continue exploring any option you get your hands on before you go ahead and do that invasive procedure. And ask me any questions you might have. So appreciate your time. Take care.